can't wait. Welcome back to our deep dive into the world of fungal and protozoal diseases. Before we jump into more fascinating diseases, let's take a moment to clarify some of the medical jargon we encountered.
That sounds like a good idea. I admit I got a bit lost in all the mycosis and mycosis terminology. It's like learning a whole new language.
It can feel that way, for sure. But medical terminology is really about breaking down those complex ideas into smaller, more manageable pieces. Let's take dimorphic fungus, for instance. We heard that one a few times.
Yeah, dimorphic fungus. It sounds kind of sci-fi, like something from another planet.
Right. Well, it does involve a kind of transformation. A dimorphic fungus, it's a type of fungus that can switch between two different forms depending on where it is.
Two forms.
Yep. Outside the body, it might be a mold producing those airborne spores we talked about.
Yeah.
But once it gets inside a warm-blooded host, like us humans, it changes into a yeast, and then it starts budding and multiplying.
So it's like a microscopic chameleon, adapting to its environment. That explains why these fungi can be so tricky to deal with. Exactly. They're masters of disguise. And speaking of yeasts, it's important to remember that they're not always the bad guys. Yeasts are single-celled fungi, incredibly common everywhere, really. Some yeasts are actually beneficial, like the ones used in baking and brewing.
Yeah, I love a good sourdough bread. So not all yeasts are out to get us.
Right. But when certain types get into the wrong place, like our lungs or bloodstream, then we have a problem.
It's all about location, location, location.
Yeah.
Now let's talk about those spores we keep hearing about. They seem to be the main culprits in spreading those fungal infections.
You're right. Spores are like tiny, tough seeds released by fungi, incredibly resilient. They can float through the air for miles, and when we breathe them in, they can lodge in our respiratory system and, in some cases, start growing.
It's amazing how something so small can cause so much trouble. What about dissemination? That's a word we've heard a lot when the infection spreads beyond where it started.
Right. Dissemination means the infection's gone rogue. It's broken free from its original spot and traveled to other parts of the body, usually through the bloodstream or lymphatic system. And that can lead to complications affecting various organs: skin, bones, even the brain.
That's a scary thought. Speaking of things that sound scary, let's talk about ulcerations. We've heard about all sorts of ulcers today. Can you give us a quick refresher on what exactly an ulcer is?
Sure. Ulcers are basically open sores on the skin or mucous membranes. They can be pretty painful, slow to heal, and sometimes leave scars.
And we even heard about some ulcers that look like volcanoes.
Ah, you're thinking of those cutaneous leishmaniasis lesions. They do have a rather dramatic appearance, but ulcers can come in many forms depending on the cause and where they are.
Right, so many different types. And what about the term lesion? Is that just a general term for any weird spot on the body?
Pretty much. A lesion is any area of abnormal tissue. It could be a wound, a rash, a tumor, or even those ulcers we've been discussing.
So lesion is the broad term, and then we have more specific terms like ulcers or nodules, depending on what the lesion looks like.
Exactly. You're getting the hang of this. Now, here's a term we don't want to hear too often: necrotic tissue.
That one does sound a bit grim. What exactly does it mean?
Necrotic tissue is tissue that has died, whether from injury, infection, or lack of blood supply. It often looks black or discolored and can have a really unpleasant odor.
Okay, I think I've had enough talk about necrotic tissue for one day. Let's move on to something a bit more positive. What about the term immunocompromised? We've talked about how people with weakened immune systems are more at risk for these infections. Can you explain what that means?
Of course. Immunocompromised just means a person's immune system isn't working at its full potential. This could be due to a whole range of things, like medical conditions like HIV/AIDS, certain medications like chemotherapy, or even just getting older.
So these individuals need to be extra careful about protecting themselves from these infections.
Absolutely. And finally, let's touch on histopathology, which is the study of tissues under a microscope to diagnose diseases. It's a really important tool for identifying those fungal and protozoal infections.
Histopathology sounds very high-tech.
It does, doesn't it? But basically, a pathologist examines a biopsy, a small sample of tissue, under a microscope to look for anything unusual. It's a bit like being a detective, but for diseases.
I love that analogy. It's amazing how these tiny details at the microscopic level can reveal so much about what's going on in the body.
It's truly remarkable. And speaking of remarkable, remember histoplasma capsulotum, the fungus we mentioned that likes to hang out with blastomyces dermatitis?
Yeah, the one that loves those bat droppings.
That's the one. Well, it's time to meet the disease it causes. Histoplasmosis.
Histoplasmosis. That sounds a lot like blastomycosis. Are they related?
They are similar in that they're both fungal infections caused by those shape-shifting dimorphic fungi found in soil, but histoplasmosis has its own unique quirks.
Okay, tell me more about this histoplasma capsulatum and the disease it causes.
Well, Histoplasma capsulatum thrives in environments rich in bird and bat droppings. Think caves, chicken coops, old barns, places where these creatures like to hang out. And the central and eastern United States are hot spots for this fungus.
So spelunkers and bird watchers, beware. How is histoplasmosis transmitted?
Just like blastomycosis, it spreads through inhaling those microscopic spores. Once they reach the lungs, they transform into yeasts and can cause a variety of symptoms.
So what kind of symptoms should people be on the lookout for?
Here's the interesting thing about histoplasmosis. Most people who get infected with Histoplasma capsulatum don't even know it. They might have some mild flu-like symptoms that go away on their own, but sometimes it can cause a more serious lung infection. It's called acute pulmonary histoplasmosis.
So it can be a bit of a silent operator. What are the signs of acute pulmonary histoplasmosis?
It can cause fever, chills, cough, chest pain, fatigue, that sort of thing. And in severe cases, it can even lead to pneumonia.
And can it spread beyond the lungs like some of the other infections we've talked about?
It can, but it's less common than with some of the other fungi. In rare cases, it can spread to other organs, particularly in people with weakened immune systems.
So yet another good reason to keep that immune system strong. How is histoplasmosis diagnosed?
Doctors might use a few different approaches: blood tests, chest x-rays, and sometimes they'll examine lung tissue or sputum samples under a microscope, looking for those histoplasma yeasts.
Makes sense. And treatment. I'm guessing antifungals are involved.
You guessed it. For mild cases, they might not even prescribe medication, letting the body fight it off naturally. But for more severe cases, or if someone has a weakened immune system, they'll use antifungal medications like itraconazole, or, you guessed it, amphotericin B.
Amphotericin B, the fungal foe's worst nightmare. It seems to be effective against so many of these infections.
It's a real workhorse. But let's move on to our next protozoal disease, giardiasis. This one's pretty common and has a rather unpleasant reputation.
Giardiasis. That rings a bell. Isn't that sometimes called beaver fever?
That's the one. But it's not just beavers. It's caused by a tiny parasite called Giardia lamblia, and you can find it in contaminated water all over the world.
So lakes, rivers, even swimming pools.
Unfortunately, yes. And it can even contaminate drinking water. The parasite often hangs out in the feces of infected animals.
Like beavers.
Beavers, other wildlife, even pets can carry it.
Okay, so if you love swimming in lakes and rivers, giardiasis is something to be aware of. How do you get infected?
You get it by swallowing contaminated water. So swimming, boating, even drinking untreated water can put you at risk.
That's a good reminder to always carry a water bottle with you when you're out and about.
Yeah.
What about the symptoms? What happens if you get giardiasis?
Well, here's where it gets a bit unpleasant. The main symptom is diarrhea, which can be, well, quite explosive and foul-smelling. You might also experience abdominal cramps, bloating, gas, nausea, and fatigue.
Definitely not a good time. How long do these symptoms usually last?
If you don't get treatment, they can drag on for weeks or even months. But the good news is there are effective treatments available.
Thank goodness for that. What kind of treatments are we talking about?
Doctors usually prescribe antiparasitic medications like metronidazole or tinidazole. They're usually taken for just a few days, and they're really effective.
So if you think you might have giardiasis, see a doctor and get treated. Don't wait for it to go away on its own.
Exactly. It's not worth the misery. And of course, prevention is always best. Make sure you're drinking safe, treated water, especially when you're traveling or camping.
This has been another whirlwind of fascinating, if sometimes slightly unpleasant, diseases. We've gone from fungal infections spread by bat droppings to a protozoal parasite that can make you regret that swim in the lake.
It's been quite a journey. But we have one more stop on our deep dive, ready to tackle amoebiasis.
Amoebiasis?
Yep.
Bring it on. I'm starting to feel like I can handle any medical term you throw my way.
I admire your enthusiasm. Amoebiasis is caused by a single-celled parasite called Entamoeba histolytica. It's a global health problem, especially in places where sanitation isn't great.
So this one's linked to hygiene and sanitation then?
Absolutely. It spreads through what we call fecal-oral transmission. Basically, you ingest the parasite cysts through contaminated food or water.
So washing your hands thoroughly and being careful about food hygiene are key for preventing this one.
Spot on. And here's something interesting about amoebiasis. Most people who are infected don't actually experience any symptoms. They're what we call asymptomatic carriers.
So they're carrying the parasite but not feeling sick.
Exactly. But around 10% of people infected with Entamoeba histolytica do develop symptoms.
And I'm guessing those symptoms aren't pleasant.
You're right. The most common and severe form of the disease is called amoebic dysentery.
Dysentery. That doesn't sound good.
It's not. It causes severe diarrhea, often with blood and mucus, plus abdominal pain and cramping. In some cases, it can even lead to life-threatening complications like liver abscesses.
Okay, this one is definitely one to avoid. How is amoebiasis diagnosed?
Doctors can often find the parasite in stool samples, and for more complicated cases, they might use imaging techniques like ultrasound or CT scans to look for those liver abscesses.
And I bet I know the treatment. Antiparasitic medications.
You're on a roll today. They'll use medications like metronidazole or tinidazole, similar to what they use for giardiasis. In severe cases, they might add other medications to manage those complications.
It's incredible how many different types of microscopic organisms can make us sick. But we've also learned so much about how to protect ourselves and the importance of early detection and treatment.
Exactly. Knowledge is power when it comes to health, and understanding these diseases is the first step towards prevention and managing them effectively.
Well said. But before we wrap up, we have one more segment to go. Stay tuned for our final thoughts and some key takeaways from our deep dive. And we're back for the final part of our deep dive into fungal and protozoal diseases. We've covered a lot of ground, from those tongue-twisting names to the microscopic villains behind them.
It's been a wild ride through the microscopic world, but now it's time to step back and see what it all means for us in the real world.
Right, because knowing all these medical terms is great, but what can we actually do with this information?
Well, I think the biggest takeaway is that a healthy immune system is your best defense against these infections.
It's like having a strong army protecting you from invaders.
Exactly. But when our defenses are down, these tiny organisms have a chance to slip in and cause trouble.
So how do we keep our immune systems in tip-top shape?
It really comes down to the basics. A balanced diet, plenty of fruits and veggies, whole grains.
Right, the good stuff.
Yep. Regular exercise is key too. And getting enough sleep. And managing stress. It all adds up.
Those are good reminders for all of us. But what about avoiding these infections in the first place? Any practical tips from our deep dive that we can apply to our daily lives?
Absolutely. Good hygiene is paramount. Washing your hands often, especially after being around animals or soil, that's crucial.
I'll admit I'm not always the best at hand washing. But after learning about all these microscopic parasites, I'm definitely going to be more diligent.
It's a simple habit that makes a huge difference. And we also talked about cooking meat thoroughly to kill off any potential parasites. And when it comes to water, always stick to safe, treated sources, especially if you're traveling or camping.
Right, no drinking from that pristine-looking stream.
Exactly. It's better to be safe than sorry.
It seems like awareness is really key here. The more we understand about these diseases, how they spread, what to look out for, the better we can protect ourselves.
I couldn't agree more. Knowledge really is power when it comes to health.
So are these fungal and protozoal infections becoming more common? Is this something we should be really worried about?
That's a tough question. There's definitely some evidence to suggest that fungal infections in particular are on the rise globally.
Why is that?
Well, there are several factors at play. Climate change, increasing resistance to antimicrobial medications, and the fact that more people are living with compromised immune systems.
Right, there are a lot of things that can weaken our immune systems.
Exactly. But it's important to note that we're also getting better at diagnosing these infections. So it's not just that there are necessarily more infections, but we're more aware of them now.
That makes sense. And with more awareness comes more research and hopefully better treatment.
Exactly. It's all about progress.
This has been a truly eye-opening deep dive. I feel like I've gained a whole new appreciation for the microscopic world and how it can impact our health.
It's been a pleasure exploring it with you. And remember, if you ever have concerns about any of the diseases we've talked about, always consult a healthcare professional. They're your best resource for diagnosis and treatment.
Great advice. Well, that wraps up our deep dive into fungal and protozoal diseases. We hope you found it informative and, dare I say, even a little bit fun.
And as always, we encourage you to stay curious, keep learning, and take care of your health.
Until next time, stay informed, stay healthy, and thanks for joining us on the Deep Dive.